Good afternoon, welcome to the Midday Brief on Joy News on Multi TV. My name is Nia Krofi Smartabe. Coming up in this edition of the bulletin, the Ghana Government Hospital and Pharmacists Association has decided to restore services to some HIV patients or persons living with HIV and mental patients. We'll be finding out from the two groups if they have indeed started receiving services from GOSPA, and then also we'll be getting an update from the Supreme Court, which has just taken a break. We have all these plus some wellness and some briefs coming up. Do stay with us. Okay, the Supreme Court just went on a break, so we'll be crossing over live now to our correspondents on the field for an update on today's proceedings, as well as some reaction from some lawyers at the court.
Welcome to the Supreme Court. Today is another day of cross-examination. Lawyer Chachichi Kata, who is the lawyer for the third respondent at the National Democratic Congress, is still on his feet. The court has just taken a short break. But I have Nana Atudazi here. But before I introduce him for us to have a brief discussion essentially about what did go on today, we just have to inform you that officials of KPMG have arrived here at the Supreme Court, and shortly, anyway from now, they'll be meeting with the registrar of the court and party representatives. Last week there was a directive that an auditing of the figures to be done 11,842, which Mr. Chachikata is disputing. So officials of KPMG and the registrar and representatives of the various parties have a meeting at 12:30 to go into that, and then the modalities is set, and then the auditing process will start. But I have Nana Atudazi, who speaks for the NDC. Good afternoon, and thank you for your time.
Thank you very much.
Good. So in summary, this afternoon, yesterday, the direction was that your party and that of the petitioners meet and iron out the various categories in order to sort of sort them out in lots, so that we can move and up the process a bit. I mean, from where I stand, I didn't see that happen, because it's the same pull out of pink sheet one after the other.
Yeah, thanks very much. I think that obviously there was a challenge. It's basically time constraint, as Mr. Addison said. He had been given a list, and they were to respond to the issues on the list, show the counterpart, serially. Unfortunately, they came back with what they claim are the answers, but not according to the list. So that immediately made it difficult to pair up the list itself. Obviously, it meant that if you to look for, say, the pair to question 1 or issue 1, you probably have to look at number 38, turning and whatnot. So he did indicate, Mr. Addison did indicate that they might want to clean it up, sort it out, and bring it up. But the court thought that instead of just breaking, we may as well do the best as we can, which really meant going back to the old system of dealing with the issues as and when we see them. These are really challenges, administrative challenges. As Mr. Addison said, they could have done it, but they didn't have enough time to put the thing serially.
And it's kind of a very tiring process. I mean, even as a journalist, sitting at the press boxes there, and you could see most of your colleagues appear to be pretty much tired about the process itself. I mean, can't we find an innovative way to do it? Is it possible, for example, that the court will extend the time and ask the parties to sort out and then come back before it?
Sure, that would have been the ordinary, system. For instance, the court could have possibly have said, okay, let's take the morning off and then start at 2 o'clock or 1 o'clock, so that you can have time to sort out the cleanup and then we come and put it all in. But the perception. This is a very peculiar trial. There's so much anxiety, so the court is also affected by it. So they want to be seen doing something at all material times. It's challenging, and we must all, as a people, simply admit that these are not your ordinary trial.
And then you also acknowledge that we are racing against time. Yesterday, for example, Justice Atuguba reminded all of us that we are in May, and very soon we'll be in June, July, and we've not even covered enough ground.
Yes, I sympathize with the judges, I sympathize with the court, I sympathize with our whole judicial system, but they are fighting against very solid odds, Again, this is not an ordinary trial, you understand? The time constraints set out, the expectation, people think that in 2 weeks it will be over, in 1 month it will be over. That's not true. I particularly, you remember? Let's recall, I've kept saying that you can't have this trial in that short time that everybody be saying. And people were ridiculing me. Because you see, when you produce, for instance, the area of battle now, 6,823 exhibits or polling stations represented by exhibits. You understand? And you will say that in each of those 6,823, there were, defalcations or errors, and you put them all in an affidavit, and you call on the other side to come and respond to. You don't expect that they will respond to only 100, 200, or 2,000 out of the 6,000 and leave it as it stands. You see, the conclusion will be that, well, you've done well with 1,000 or 2,000. But you have not responded to the 4,000 remaining. So that is why it would appear as though the NDC or the third respondent, represented by Mr. Tachuchikata, appears to be wasting time. He's not wasting time at all. If I may just quickly move on. Look, what is happening for the last 5 days is what I would term the battle for the serial numbers. If you're not a lawyer or you're not very well versed in it, you may not understand what is happening. But it's a very serious battle going on.
We want to talk about serial numbers on the pink sheets that were used for the election.
Yes. Yeah, we're talking about in paragraph 56 of the affidavit in support, they are claiming that about 50 to 55% of the pink sheet, was bogus in terms of this overvoting. You understand?
When you say they, you mean the petitioners?
The petitioners are claiming that there was overvoting, represented by about 6,823 polling stations, and this translates to 2.6 million votes. 2.6 million votes. Now the total number of votes that they seek to annul is 4.6 million. You see, so if the serial numbers alone constitute 2.6 million, then you are talking about more than 50%. You see, so our business now is to unravel the myth surrounding the 50% of their claim. You see, to show that the so-called serial number is irrelevant. In fact, Mr. Chachukata has continuously been saying that if you want to identify a polling station, you don't identify it by its serial number. You identify it by the polling station code, You identify it by the polling station number, the presiding officer, and then the polling agents, because these two persons cannot be the same persons in two different polling stations at the same time.
Yeah, but with respect to the serial number, for example, yesterday Dr. Baumia said, I mean, the Yesu could not have put in that serial number there for want of, to use his own word, decorative purposes.
Yes, I'm saying that. I'm saying that for. So you may as well just say that EC should not have used, a short script paper. It can be anything. You can have any grounds. But I'm saying that we must address the key points in identify what are the key points to use to identify in a sheet. You understand? Let's not forget that in any case, the pink sheet is an after event. You understand? The critical thing in an election is not the pink sheet. The critical thing in an election is a ballot paper. The ballot paper has a serial number. That is what you should be fighting over. That is what your polling agents are interested in. You see, so today when the banter was on, Mr. Chachikata pointed out, but your agents were there, and his answer was, "Oh, but you don't expect the agents to see everything." You get me?
Yeah, but do you expect? But do you also expect your agents to have seen everything?
Oh no! Just the answer. I'm saying. The answer, Mr. Chachikata shot back was that the polling agents didn't consider the serial number of the pink sheet relevant, because what they want to know is that the paper before them that they are selling, does it have the polling station code number? Does it have the name, appropriate name? You see, is the presiding member, the officer, the same person who preside over the did he sign or did he not sign, or did they also have the opportunity to put their names on? So the long and short of it is that our case is that the so-called 6,823 polling stations they are quibbling over only represent photocopies of their original pink sheet, which they have stamped and exhibited.
That is what you think. That is
our case. That is our case. And we've said it over and over again. And that we say is what translates into the duplicates, yes, and the triplicates and the quadruplicates. You understand? Yes. Of course, Mr. Baumia has...
But there's an auditing process, so that will, for example, put to rest all of those doubts in your mind, I guess.
We hope so, but this is evidence, you see. So the auditing is only part of it. At the end of the day, even after the auditing, we will have to demonstrate that if there, you see, the auditing will only show you the pairs and whatnot, but it won't demonstrate in terms of the explanation as to why the pairs. You see, so Mr. Chachikata's program, or what he's doing now, is to show that there were pairs, but beyond the pairs, to demonstrate that the pairs were as a result of the so-called photocopy or duplication and triplication and whatnot, and not the overvoting as claimed by the other side.
Now, let me ask you, still on Chachikata's cross-examination, there are a lot of talk out there, which you yourself have alluded to, about the fact that he appears to be kind of dragging the process. I mean, from where you stand, you think it's going to finish this week or next week?
Well, to answer the first part of it, I have demonstrated to you that it will be completely irresponsible on the part of Mr. Chachikata to race through or to short circuit, as they say, interrogating
and mental patients, although the strike has not been called off. 2 weeks ago, the pharmacist reviewed services to all emergency cases, services to HIV patients and persons with mental conditions. This was in reaction to what they say is government's deliberate disregard for their demands for a fair, equitable and judicious resolution of their migration onto the single spine salary structure. The National Secretary for GOSPA, Franklin Echampon, denied publications that suggested they have called off their strike, adding they are currently providing only HIV services and patients that are admitted to the psychiatric hospitals medication. According to him, the move has become necessary because of the commitments that the ministry and the Chief of Staff are showing to find a lasting solution to their discrepancies. He indicated that the strike has, however, not been called off. Well, joining us on the line now is Reverend John Amuzu, who is a spokesperson for persons living with HIV and is also an advocate for HIV as well. He joins us to give us some more background into this particular developing situation. Good afternoon to you, Reverend Amuzu, and thanks for joining us on the Midday Brief.
Yeah, thank you. The name is not Amuzu, but Azuma.
Azuma, sorry. Yes, thank you. Yes. Thank you very much, Reverend Azuma. Okay, first of all, can you confirm to us if indeed pharmacists have started attending to PLWHAs?
Yes, for now, I would say no. No, in a sense that there are so many hospitals now that are still not providing the retroviral drugs. You mentioned of Lekma Hospital. As we speak now, they are not providing retroviral drugs. You mentioned La General Hospital. You mentioned Tema General. You mentioned Ashama Polyclinic. They are all not providing the retroviral drugs. Even as we speak now, pharmacists at the hospital have a short stock of because they are on strike. They don't have any retroviral at the pharmacy, so they are not able to go to Tema, the warehouse, and bring more retroviral drugs. And these are really causing a big challenge to persons living with HIV.
Okay, Reverend Azuma, just hold on for me 1 second. I understand I've been joined also by Dr. Kwesi. He's the chief psychiatrist. Good afternoon to you, Dr. Kwesi.
Hello, good afternoon, sir.
Okay, can you also confirm for us if pharmacists have resumed work or by attending to patients with mental conditions?
Well, our Deputy Director of Pharmaceutical Services, that's the top process, has been on duty all along. So he has been assisting the technicians to administer medications. But I'm not yet aware that the junior pharmacists have resumed.
Okay, so you haven't seen them at work even today?
Well, I've not seen them, but normally I will not see them routinely unless I specifically go there because they are at another unit serving the patients. But I've seen the Deputy Director of Pharmaceutical Services. He is on duty.
Okay, but what sort of impact is the strike by the pharmacists having on the patients at the psychiatric hospital? Because the last time one of our colleagues did a story, one of the women said if she goes off her medication by at least a week, she's going to relapse, and she was afraid of that particular incident coming through.
Yeah, that's true. It had serious negative impact. Because they were on strike, the technicians and the deputy director of pharmacy, they had to restrict their services to the inpatients and, put it as selected outpatients. So most of the patients were really not safe, and as the other patient just said, it's true. If there is a medication that kills them, some of the patients will require medication. As long as they're on the medication, they are fine. Others, you can put them on the medication and then stop them after some time. Whichever way, it is very crucial that you have the medication. So if for whatever reason they are not getting, or if they don't get it at the hospital, they have to go to town to purchase and they cannot purchase, then it has a very bad negative impact on them.
So how have they been coping then?
Those who do not get it from here have to try and get it from town. And as I said, if they can't get it from town, then they live with it. Or some even decide to prolong the period. If they are supposed to take it twice a day, some decide on their own to take it once a day so that they can prolong the period. But that means they are not getting the optimal dosage. So it obviously has negative impact, and we are hoping that all these issues will be resolved very quickly.
Okay, and Dr. I'll say, please hold on for me. Let me just ask the same question to Reverend Azuma, if you're on the line with us. How much of an impact is the non-attendance or non-availability of the ARVs to you affecting you, the persons living with HIV/AIDS?
Yeah, thank you. Like my colleague doctor has just said, if we don't have the drug, it has a lot of negative impact on our health, because it is a drug that you have to take daily. Every day you have to take it morning and evening. So if you don't take it, what happens is that you get a reinfection. And when you get reinfection and you start taking the drug again, you get a lot of complications. And these complications can kill you. And another reason again is that when you stop taking the drug, you have a lot of chances to spread the virus to other partners whom you don't know. And again, when we are talking about prevention of mother-to-child transmission, so pregnant woman who is not being given the drug, have the chance to transfer the virus to the little baby. So if we are not able to solve the problem, there's going to be a lot of complications. Babies are going to be infected. General public are going to be infected. The person living with HIV himself will have complications, and it can lead to death.
And in your case, are you able to get your ARVs over the counter, as it's probably the case for some of the patients Dr. Akwesiose was talking about?
No, our case is not like the psychiatric. We have no even chance to go to the market and buy the drug. The drug is only at the pharmacy. You can't go to any pharmacy in town, any drugstore and buy. You can't get it. It is only restrictedly at the pharmacy. So when we don't have it, we are seriously in problem.
Okay, so now that the pharmacists have said that they are going to attend to PLWHAs, how are you going to ensure or rally your members to ensure that you actually do hold the pharmacists to their word and do get the supplies that you need?
Yes, we are still appealing that if truly they say they are coming back on work, then they should provide us with the service. Their men should be at the center, so that when we go, they'll give us the drugs. Because as we speak now, they are only saying they are resuming work and they are giving us the drugs. But when you go to the ground, the issue is not like that. Like I mentioned, Lekma Hospital. If you go now, no pharmacy is on duty. Have you been
to any of these major outlets where you get them at least today, and you haven't seen the pharmacist at post?
Yes. These hospitals I'm mentioning for you, I've got the report right from the center today. That when you go there, they are not giving the retroviral drug. So we are begging them, appealing to them that life is important. We understand their case, and we are also appealing to the government to come to their aid so that the problem will be solved. But while they are solving the problem, while the dialogue is going on, they should let their men be at the center and provide the retroviral drug, because with this we can save lives.
Okay, thank you very much, Reverend John Azuma. Doc, if you're still on the line with me, so what's the way forward then? Then pharmacists say they are going to start attending to your patients, but as it stands now, you're not too sure whether they have resumed. How are you going to handle the situation?
Well, I think it's important that we do everything we can to resolve the issue. If anybody thinks that, well, after all, they are not there and we are surviving, that certainly is not right. I mean, we are surviving, but we are not actually getting the right situation. So whatever needs to be done to resolve the issue, we need to. If we need to sit down, and I think we should sit down, both parties should sit down, government should sit down with the pharmacists, we resolve the issues. Wherever the difficulties are, we need to find out. But otherwise, if you think, well, after all, they are on strike and things are working, things are really not working. And it's very important that we recognize that and resolve whatever the issues that there are.
But in the meantime, do you have any alternative plans for taking care of the medication of your patients?
Well, as I said, the senior most pharmacist comes around. In fact, he's there. As a member of the management, he has to be around, and he comes, so he assists the technicians, so that is what we manage. And so we are doing the best under the circumstances, but it is not as if everybody was around, and that's the situation. Okay,
we do wish you all the best, Dr. Akwesiose. We do hope that the pharmacists do indeed return to their posts as they have promised. Earlier also I was speaking to Reverend John Azuma, not Amuzu as I said, Azuma. He's an HIV advocate, and he was also telling us that at least so far today, reports he has gathered from the major centers where they do get their ARVs indicate that the pharmacists have not as yet reported at their post. But we do hope that hopefully before the close of day they will indeed return to take care of these patients. But let's move on now. Work on Job 600, which started in 2007, should be over in 6 weeks, but without fixtures and fittings. The contractors want an additional $26 million from government to complete the edifice for parliamentarians to occupy. That this was made known when Sector Minister Collins Dauda toured the facility Monday.
Sector Minister of Works and Housing Collins Dauda, his deputy, some technical men from the ministry and consultants of the ADK consortium, ahead of the completion of the Job 600, toured the facility to assess the level of work done. Resident engineer Bentil Enchel briefed the minister and his entourage about work done so far.
Now the interior works are being tackled from top down. And you'd have noticed that up on the 11th floor, doors had been fixed, lighting was in place, air conditioning was functioning. As you came down to lower floors, some of these may be missing, but we are working on all of this at the same time. A little down the line, we expect to close up all the offices and tackle a bit of remedial work all over.
Chairman of the ADK Consortium, Michael Kreku, explained their request for the additional amount.
The top-up is 26 million. The 26 million, I think 13 million goes for the furniture and fixtures. In about 6 weeks' time, we should have all the offices done, ready for the fixtures and the fittings.
The sector minister expressed doubts about the likelihood the job will be completed on time.
The AUSL has been commissioned to assess work left and to advise when work will be completed. But at least, even before the project commenced, some timelines were agreed upon. So we hold them to the end of June. At the end of June, we'll come back to see whether work is completed or not. If it's not completed, the next action will be taken. At the end of June, inshallah, we'll come back and see whether work is completed or not.
He then urged them to double their efforts to be able to complete the project by June. The new Job 600, when completed, will serve as an office complex to house the members of parliament and offices for research assistants and secretaries.
Well, today also the same Minister, Collins Dauda, is touring some housing projects in the capital. We'll bring you updates on that in our subsequent bulletins. But let's move on now and still stay with construction. The contractor executing the Tamale Salaga Road project, AN Ganem Limited, has threatened to abandon the site at the end of this month if government refuses to complete payment for work done on the project so far. Project engineer Samuel Edu said that it was becoming difficult to pre-finance the project as the company's funds had been locked up in other completed works. Roads Minister Alhaji Suleimani, however, appealed to the contractor to bear with the government and continue with the project as it worked towards clearing the backlog of unpaid road construction arrears. AN Ganem was contracted by the Ghana Highway Authority in October last year to construct the 62.4-kilometer Tamale Salaga Road at the cost of 28.21 million Ghana cedis. Work on the project is expected to be completed in October this year, but now it appears unlikely.
The Tamale Salaga Road forms part of the Eastern Corridor Road project. The 62.4-kilometer road project, which started sometime in October last year, is about 40% complete. Major construction works, including earth clearing and the construction of culverts, have already been carried out on the road. The road, when completed, would ease traffic on the Tamale Salaga stretch and will assist in the transportation of agricultural produce, including yam from Salaga to Tamale. But the road construction project is under threat of a major delay. Since October, when the contract was awarded to AN Ganem Limited, government has failed to provide additional funds for the speedy completion of the road project. Project engineer Samuel Edu told Roads and Highway Minister Alhaji Amin Amidu and his team of engineers during an inspection tour of the project that the company will be forced to pack out of the project site by ending of May this year if government does not commit funds into the completion of the road.
Well, we are not glad, but we are suspending the road because there's no money to continue the constructions. That is our main problem now. We don't have money for this.
You don't have the money, you accepted the contract. You know, Ghana government contract, you have to wait before we pay.
That is true. That is true. But unfortunately, there have been other projects where...
But you've been doing very well in the past, so continue. We'll pay you.
He added that it was becoming difficult to pre-finance the project as the company's funds had been locked up in other completed works. The Northern Regional Director of the Ghana Highway Authority, Kwame Kranchie J., also told the road minister there was the need to protect the investment already made on the road by undertaking more filling works and culverts.
The problem that we are having is that the SIMS is doing more of the filling works without putting in the drainage structures. That's the cross drains and even the drains on the sides of the road. And I'm telling you that when you do that, you haven't finished with the project, because if we pay and you leave the site, the whole thing can get washed off. again, we're still designing the project. Maybe there could be a point that we will know that we will think that the level of fill is not adequate. So the drainage structures are there, we'll be able to monitor if we get into the rainy season. So this is the problem that we have with it. We are also saying that, yesterday or two, we had a letter from the contractor telling us it's ready to demobilize from site because of non-payment by the end of this month, May. That's the only issue that we have now.
By the end of the month, May.
Roads Minister Alhaji Suleimani, however, appealed to the contractor to bear with the government and continue with the project as it worked towards clearing the backlog of unpaid road construction arrears. The minister and his team also inspected the 103.39-kilometer Bupe-Tamale Road. Currently, the project being executed by China Jiangxi Corporation for Economic and Technical Cooperation is about 56% complete. The Bupe-Tamale Road project is being jointly financed by the government and the International Development Assistance of the World Bank. The resident engineer Solomon Sumi said there was the need for the urgent construction of bad sections of the road so it did not erode the gains made on other sections. The minister expressed worry about the absence of road signs on the stretch and advised the contractor to mark completed portions of the stretch to improve visibility at night and consequently reduce accidents.
The safety is as important as a good road. So whilst we are working, we want to make sure that the road is also safe for users, particularly the markings, so that people are driving, they know where to pass and then safe. That's very, very important.
Especially in the night.
Yeah, especially in the night. So please, he said that he has told you that if you don't do the markings, he won't allow you to work. So are you prepared for that?
Yes, we are.
All right, you do that quickly. Very important. And I ensure that this road, we worked on it not too long ago, but we finished this road about 1996 thereabout. And we are spending so much money again to do it. So we want to make sure that this time we have value for money.
While you're watching the Midday Brief here on Joy News on Multi TV, we'll take a quick break. Stay with us, we have some more stories coming up. Well, information we've gathered indicates that the NDC is holding a press conference in Enyinam in the Eastern region to protest the possible reappointment of the DCE at Tachum. The press conference was addressed by Ben Papito, the constituency youth organizer, and other party executives. Roxanne JC joins us live with an update. Good afternoon to you, Roxanne.
Hello.
Yes, so tell us, what is their problem with the DCE's appointment?
When they organized the press conference, it was addressed by one Owusu Utim Ernest, who is the secretary of the youth, then assisted by one Ben Papito, the youth organizer. They are appealing to the president not to reappoint Honorable Atachum as DCE for Etiwa. Their reasons are many. Among some are that the DCE does not support the party. He is a failure since he was elected as the DCE for the past 4 years. Also, his relationship with the party supporters is not cordial. More so, he has never supported any NDC member who has aspired towards a high position in the constituency. Instead, it is MPP members, for example, Nana Pitua II, Queen Mother of Ismako, who has been assisted to ascend to the throne of the presiding member of the district. He also awards contracts without considering equal qualified party members because of his selfish interests, allegedly. They are also accusing him of, that many of the assembly scholarships are not quarterly and evenly distributed. That is the quarterly allocation of the constituency. They are saying that the security agencies are not giving the residents in the constituency, but it is outsiders who are considered in the award of the contract. He has also never met even one of the executive members who has wished to organize party meetings with him. This and other reasons, but more especially, they are alleging that the DCE is behind the Galamsey operations that is going on in the district. Possibly, that is the reason why he cannot control the activity of the Galamsey and illegal mining. It is in the light of this that they are appealing to the president that 3 people, apart from the DCE, are aspiring for the DCE. And any of them they support, apart from Honorable Atachum, and that if any of the 3 contestants is considered, they don't have any problem about it. But when the president does not heed to their passionate appeal, then they are going to sit on the fence and make sure that no party activities are organized so that the NDC will sink into the gutters in Etiwa district.
Okay, Roxanne, most of these issues sound more like a personal vendetta, if for want of a better word, between the NDC members and the DCE. What has the DCE himself got to say in face of all these allegations being made against him?
The DCE has refuted all the allegations. I am yet to meet him personally for an exclusive interview with Murphy, but he spoke to some of the media houses denying all the allegations. But when we contact him personally and we have an interview, maybe the follow-up will be made.
Okay. Unfortunately, Roxanne's line is getting bad, but of course, we've got the import of your report. Thank you very much, Roxanne. He tells us that the DCE has so far refuted allegations that have been made by the party members, and so Roxanne himself is trying to get an exclusive interview with the DCE at Ochum, and once he does that, of course, we'll get it to you live here on Joy News. Let's move on now. The people of Abonya, a village near Dodowa, are still living in fear following an attack by suspected land guards late last month. Weeks after the incident, the horrified residents are refusing to return to the village for fear of being attacked again by the armed men who threatened to return.
Abonya at this time of the season, on any other day, according to the people, will be very busy with the mango business. People come from neighboring towns and villages and from the central business district to transact business. But this is that community today. Almost a ghost town. The alleged land guards destroyed properties and physically assaulted children and some women using machetes and guns. Solomon Soji, who was physically assaulted, told Joy News he is constantly living in fear, but the arrival of the news team gave him hope.
The first I don't feel comfortable walking around, but now I feel comfortable.
Terry Matthew, who also suffered cutlass wounds, shed tears when he tried engaging the news team in a conversation. Recounting his ordeal was a challenge.
I'm not feeling happy because how they did to us, I'm not feeling happy. And we just came here and come and cook and go back. What is going on, we can't predict it. And so we want them to come and help us.
The chief of the Abonya abandoned the village to save his life. He alleged the attackers returned later with a group of policemen to scare them off the land. He said they captured the name and number of one of the officers that came with the attackers the second time.
Police for dear police for Jam, I met on Langas. Police for I met on Langas. Now, member, one number number. I told Mr. MK is here. MK is here. I'm a coming just what units. Ni number G41192. Mr. Niloli Namakabaji. DP, Tamonisa Patrol, DP, 2631. Dilolina Makaba. Oh, I can't go on. Oh, I'm part of me finding a Kayaomi. Nika police foil and a jam, best stop on me. Nemeni do a wall home. Aquana Kayomi, stop on me.
This woman, who says she almost died at gunpoint because she refused to give up the husband who the attackers were after. The few people that the news team met, we were told, come in the morning to change their clothes and prepare food, then flee Abonya to other neighboring villages for fear of losing their lives. Even though there is security presence, the safety of the people is still not assured. Efforts to reach the divisional commander to clarify the allegations were unsuccessful.
Well, that's a rather worrying development there. But leaders of the Kantamanto market have denied any directive by the AMA asking them to move to other designated markets, including the Tuesday market in Accra. According to their leader, the AMA has not informed them about the relocation, and even if they have to go, there will be no space for them because there are too many of them to fit into the available space.
This was the state of the markets when we got there today. Though scattered, some traders still found some place to sell their items. Others were still counting their loss after the fire.
It becomes a gimmick. When you say go to Odona Tuesday market, over 15,000 people. So why can we go to Tuesday market and Odona market? Odona market is already, it's given out already. And our numbers, even is far more than it can contain. We are talking in a region of over 15,000 people. And Odona market is around 40,000. And it's almost full there.
According to the leader, Samuel Amwa, the Tuesday market cannot contain all of them. On the 6th of May, some traders were arrested by the police for rioting after the fire, armed with dangerous weapons with which they attacked members of the general public, but said it was due to miscommunication by some traders who heard the land had been sold to the Chinese.
There was lack of communication between from the top and our police. Initially, we heard they are going to sell the market to some Chinese people. So people were living in insecurity. The very day that the market was destroyed, we heard that, okay, we are going to be sacked. So the next day we heard that the Zoom Lion vehicles were around. So, okay, then it's true. And that's what let the people go out there. It was not the best, but it was a matter of panic reaction.
The construction of the new market is set to begin in July.
Now, though fraught with fraud and other illegalities, susu operations remain popular in the informal sector. For convenience and cost's sake, low-income earners will rather save with susu collectors than with a bank who processes they consider highly cumbersome. Abigail Adoma Kwenchi has more.
Several banks and other financial institutions are springing up in the country but are yet to fully operationalize in the informal sector. Traditional susu collectors have rather gained grounds in the sector, providing informal means mostly for low-income earners to save and access credit. Several operators are known to have collected monies and absconded with them, but others are still trusted. David Asafuache Ajayi Tego has been a collector for the past 31 years and has about 700 clients.
We collect the money and then pay them, we give it back to them at the end of the month. So there's nothing like interest on it, but they save with us in order for them to pay their children's school fees, their electricity bill, whatever commitment they have, maybe their house rent and other things, and then they pay. As I work, as an intervals, I'll be saving the money at the banks. So at the end of the month, we pay back whatever they give to us, but we collect 1 unit of the month of whatever they give to us as our commission.
Taken after his father, who was also in the business, David has managed to build trust between him and his clients.
When they found out that I'm in an association and that there is nothing like now we are being right now regularized by the Bank of Ghana and other things, they just leave it. But they look at me as someone who has kept long in the business, and then they just contribute.
Traders who save with susu operators may still have fears of losing their monies, but the inconvenience and cost involved in dealing with banks remains a great disincentive.
If you have Juma, Benya Faso Kaka, how to go to no my Bia. Says, I didn't see first come, they bring to bank, Gabia Cabin, and you got to.
So for say, I'm boy pa because we are so now I bear 2 weeks. Na sebi, which you are not concerned, so my beer, or by mouse can be. Well, now or mouse can me the koto nyama. Now we are in time, Buson by one, scan what to Well, into there be our my 1 year ma but bank did be a discount because now na usanka.
Susu operators are to acquire licenses for the operations under the 4th tier of the new Bank of Ghana licensing regime, but the Ghana Cooperative of Susu Collectors Association maintains its compliance is a challenge. They are, however, putting measures in place for operators to comply.
We have instituted or established a monitoring and supervision department which does monitoring of all Susu collectors across the country. We are trying to introduce a uniform documentation procedure, i.e. uniform passbooks that the licensed Susu collectors can use in the market, and then their clients can identify them as such. In addition, we want to introduce ICT, where the collectors will be using point-of-sale devices for their daily collection. In this sense, they will be able to print out receipts to their various clients.
Mr. Asumeni cautioned clients to insist on licenses and identification cards of operators before doing business with them. Abigail Admakwenchi for Joy News.
Now, despite indications that Ghana is on track to achieve a number of the Millennium Development Goals, MDGs 4 and 5 are likely to be missed. That's according to a research conducted by Alliance for Reproductive Health Rights, ARHR. MDG 4 aims at reducing by 2/3 from 1990 to 2015 the under 5 mortality rate, while MDG 5 is targeting the reduction of maternal mortality rate by 3/4 within the period under review. The findings of the research were made known at a stakeholders forum at the Bongo district of the Upper East region. The stakeholders included health workers, opinion leaders, national health insurance staff, youth groups, and journalists. The research was conducted in 2012 at Bongo and Bulsa districts in the Upper East region and Agona East and Commander Edina Iguafo Ibrim districts in the Central region. The research acknowledged the fact that Ghana had mainstreamed the MDGs into the medium-term National Development Policy Framework. It indicated that although institutional maternal mortality rate in some regions had reduced, it was higher in most health facilities. The situation was blamed on unskilled delivery and lack of midwives. The research recommended the need for more midwives to be trained to provide quality delivery skills, while government should provide more logistics and medical equipment to the health facilities. Patricia. Well, we'll take another break at this point. We'll be back with some more stories. Stay with us. Well, we'll be bringing you some wellness bits in a bit. Just stay with us. Well, now let's take you across the world. UN officials say a boat carrying about 200 Rohingya Muslims who were evacuating ahead of a storm has capsized off western Myanmar, killing all but one person. And a doctor in the U.S. city of Philadelphia has been found guilty of murdering 3 babies with seizures after they were born alive during late-term abortions at a clinic serving low-income women. Now, the disciplinary committee of the Ghana Football Association has found Brekum Arsenal guilty of crowd troubles during and after their Globe Premier League match against Hearts of Oak on March 19, 2013 in Brekum. And Roberto Mancini has been sacked as Manchester City manager a year to the day since winning the Premier League.
Fans of Brekum Arsenal Club rushed onto the field after Hearts had scored, holding up play for 2 minutes, and after the game, they massed up in front of the referee's dressing room and held them hostage for 20 minutes. The Brekum side, after initially pleading not guilty to 2 counts of misconduct under GFA regulations 35(2) and 4, the club changed their plea to guilty and asked for leniency. America in late May. Malaga's Chilean coach Manuel Pellegrini has been strongly tipped to replace Mancini. On Sunday night, 59-year-old Pellegrini, who spent 1 season in charge at Real Madrid in 2009-2010, insisted there was no deal in place for him to become the new City boss. In a statement, City thanked 48-year-old Mancini for the job he had done since joining the club in December 2009. Paris Saint-Germain want David Beckham to continue at the club next season, even if he retires from playing. Beckham, 38, came on as a late substitute on Sunday as PSG took the League One title with a 1-0 win at Lyon. When asked about his plans, the ex-England midfielder said, quote, "I am going to enjoy tonight and that's what matters," unquote. PSG are believed to have offered Beckham a 1-year contract extension to the 5-month deal he signed after joining in January, after he ended a 6-year...
Ghanaian singer Raquel Shirley can sing, and although she gave a remarkable performance at the Vodafone Ghana Music Award Industry Awards ceremony, she will surely be remembered for more, as her raunchy dress revealed one sexy tattooed thigh that had heads turning.
Well, if what I read about the mastectomy is anything to go by, I'm wondering if it included the ovaries as well. But well, let's move away from that. I'm just thinking aloud. Workers at Lumni's platinum operations in South Africa have gone on a wildcat strike. The action follows the shooting of a union official at the weekend and has reignited fears of the violence that hit the industry last year. Last August, 34 miners were shot dead at Lumni's Marikana platinum mine near Rustenburg. Lumni, whose shares also listed on the London Stock and Johannesburg Stock Exchanges, is the world's third biggest platinum producer. News of the strike sent shares in Lumni down 5% in London during morning trade. And that's it for the bulletin. But before we go, GOSPA says it has restored drug supply to people living with HIV and AIDS and mental patients. But we spoke to some HIV and AIDS advocate, and he says they are yet to experience that. And also we spoke to Dr. Akwesi Osei, the chief psychiatrist, who says he's yet to see the pharmacist report for duty at the psychiatric hospital. And also the Supreme Court has adjourned hearing and possible ruling on the motion filed by the lawyers for the third respondent, the National Democratic Congress, in the ongoing election petition. And of course, we will be joining, beg your pardon, we will be joining the Supreme Court feed live again when they return from their break. But that's it for the midday news. My name is Nia Krofi Smatabe. Enjoy your afternoon.